listener production.
Hello and welcome to this episode of The Briefing. I'm Sacha Barbour Gatt. Recently I was having a scroll on TikTok when a scary-looking video with very ominous music paused me in my tracks. It was posted by the Daily Mail, which, if you don't know, is a news outlet, and it showed footage of a crammed emergency department in China with a headline claiming a mystery disease was overwhelming hospitals there. This time 5 years ago, similar videos were going around that heralded the start of the global coronavirus outbreak, and I felt like I was thrown right back to that time. A bit of a deeper look into the claims made by this video lowered my anxiety. So today, I'm joined by Professor Jill Carr from Flinders Health and Medical Research Institute to find out why people are flocking to EDs in China right now and whether we should be worried about a similar thing happening here in Australia. Spoiler alert, we shouldn't be. Professor, welcome to The Briefing. Look, first off, let's talk about these reports. It all feels very reminiscent of 2020. Are we looking at another COVID-like outbreak in China?
I think no, Sacha, and I don't watch TikTok, but I have seen some of those other media reports and feel that there is a bit of that element of, here we are again, but it's really quite a different situation in terms of the virus and our population immunity and essentially many of the things we did learn from the pandemic as well too that will really, in my view, not make this anywhere near the response that we saw for SARS-CoV-2 and COVID-19.
Yeah, so the video that I saw in particular, once you clicked on the caption, it explained that they believe this outbreak is of HMPV. Please tell us what that is and how concerned we should be, if at all.
Yeah, so HMPV, human metapneumovirus, or if you just want to call it metapneumovirus. So that's a human virus. As the name sort of says, it's linked to a pneumonia, so a lower respiratory tract infection. And so it is a virus that causes respiratory tract infections. And in those kind of scenario is very similar to SARS-CoV-2 in terms of some of those clinical outcomes. But it is a virus where SARS-CoV-2 was an entirely new virus that came over from a spillover in animals, started infecting humans, producing this unusual pneumonia syndrome. Whereas metapneumovirus has been around, they say 70-odd years, but we only really first diagnosed it as a genetically different virus in about 2001, 2002 in Australia. So it's not really the same scenario in terms of the novelty of the virus, remembering that SARS-CoV-2 started off as the novel coronavirus in 2019. So those aspects are very different and, perhaps not as frightening because there is a sound amount of basic research that really lets us know what this virus is about.
How does one contract it? Is it the same sort of idea as COVID in that it's spread through the air?
Yeah, absolutely. So it's still, I don't want to use the term aerosolized because the WHO and there was a whole discussion about all those terms, but basically respiratory droplets. So it's replicating in the respiratory tract. And as we cough, sneeze, breathe, talk, sing, all those kinds of things, those little droplets come out of our mouth and then, transmit to another person. So it is transmitted by those same mechanisms. And as I said, those things that we did in COVID, keeping a distance, wearing a mask if you think you're particularly vulnerable or infectious, can also benefit this situation as well.
Why do you think we're hearing about it now? You said it's been around since, or we've at least known about it here since the early 2000s. So why is it all of a sudden getting all this attention?
I think that does relate to maybe people still are a little bit worried post-COVID and worried that it could happen again. And we do see this same conversation with influenza, and there's been some influenza strains circulating that people have been quite concerned about. So maybe it's off the back of that people are quite worried. And I just think it is just more public awareness of the multitude of different respiratory viruses that are out there that can cause, common colds, respiratory infections, and can be very severe in those very young children, the elderly, people with comorbidities, and end them up in hospital, I think.
Now, the coverage, like we talked about a little bit at the start of our chat, of being kind of like, the language that it's overwhelming emergency departments, is that a fair representation, and should we be concerned about a similar impact in Australia like we saw during COVID?
We did see a spike in prior to Christmas. So in Australia, we will see metapneumovirus at the end of winter, start of spring, and we saw a spike in cases of metapneumovirus. We've seen all these respiratory tract viruses sort of increase post-COVID as people start getting out about their normal business and they haven't been exposed for a couple of years, so they're a little bit more vulnerable. But in terms of overwhelming the hospital systems, there've been a couple of studies of how bad metapneumovirus can be compared to some others. And we all did this in COVID about comparing, it's just the flu, those kinds of conversations. And it's quite a diverse disease presentation, as was COVID. Some people didn't suffer. Some people ended up in hospital. So it's hard to know, but I think our hospital systems are far more prepared than they were a few more years ago, having experienced COVID-19. And it just runs to capacity. Some countries will be overwhelmed if they're a little bit more resource poor. Some places might be overwhelmed. Sydney might fare worse than here in Adelaide, a larger population, a higher density living. So there is that potential, but I really feel in this kind of case that metapneumovirus is not going to overwhelm those hospital situations to the same level that we saw with COVID, because people get exposed to this every year. And so the entire population is just not going to have that same vulnerability that we saw with COVID-19.
Is it common in Australia, and is it often, mistaken in a generally healthy person as just a cold sort of thing?
Yeah, so it is common. I mean, the data can vary year to year, but I think a couple of studies have said, 20% of presentations, and it will depend on what the time of the year. Flu is more likely, April, May. Metapneumovirus, as I said, more likely end of winter into spring. And so, it is just sometimes you'd go, I've got a bit of a sniffle, a cold for most people. And you can do the rapid antigen tests, and there's some available in Australia that can detect flu A, B, RSV and COVID. I don't think there is one that can do metapneumovirus, but, I know we've all experienced that, I'm going to here, I want to do a rapid antigen test, doesn't come up with anything. You've still got symptoms. It's probably some other virus, and it could be metapneumovirus. And as I said, for most people, it might be mild, and then there might be those aged care setting children that might end up sending them to hospital.
Before we let you go, Professor, what's the advice for, Aussies at the moment if they find out they're sick? I feel like the discussion around how to keep people healthy was so... We were talking about it really well during COVID in terms of stay home. If you're sick, don't go to work. I feel like some of those habits are starting to slip and fall by the wayside. What's your advice to Australians at the moment? Should they feel sick, or should they, come down with HMPV?
Yeah, I think you're absolutely right. We were all quite vigilant about looking after ourselves and looking after about those vulnerable people around us. I can say from a personal level, we went over and saw, elderly in-laws recently, and we're always thinking, okay, how do we feel? Let's do a test before we go, if you've got the option to do that. And in the workplace, do the same thing, just to sort of keep your colleagues and those people around you healthy and safety, as well as yourself. So, I'm a big proponent for stay home if you're sick. I think we've changed our culture of giving that autonomy to stay home often from our workplaces. I realise some people can't do that, and people, I think, more accepting of, look, I think I'm sick, I'm going to stay home, I'm going to work from home, those kinds of things, and still being productive and helping to reduce the spread and, as I said, keep those vulnerable people really, really safe from these respiratory infections.
Professor Jill Carr, thank you so much for joining us today. We really appreciate it.
No worries. Thank you, Sacha.
That was Professor Jill Carr from Flinders Health and Medical Research Institute speaking with me there. And just quickly on the stats that she mentioned, Health Minister Mark Butler recently confirmed that just shy of 10% of cases presenting to GPs in Australia last year were for HMPV, and it ranked 5th in all respiratory illnesses that we're seeing here at the moment. And that is it for this episode of The Briefing. Thanks so much for listening. Before you go, we would absolutely love it if you could share this ep with someone you think might enjoy it. It is a really easy way you can support us and all we do here at The Briefing. So is sharing our socials posts. Check us out on Instagram at The Briefing Podcast. We're also on TikTok and YouTube. Search Listener Newsroom. I'm Sacha Barbour Gatt. See you tomorrow morning for the headlines.